two-time CDH mom. So we're going to learn how to better interact with the medical staff and learn quite a bit from the other side.
Hello, everybody. As you know, I'm Brenda Slavin. I've been with CHERUBS since 1995. My daughter, Amanda, was born in 1993, and my son, Nicholas, born in 1995. Both passed away due to Fryns syndrome. Wanted to be a nurse shortly after they were born, but was smart enough and had the insight enough to know that I needed to grieve first before I took on that endeavor. And when I turned 30, I had that whole, you know, what am I doing with my life passing, and went back to school, and it's the best thing I ever did. Being in the nursing industry now, coming from being the mom at the bedside, it's amazing now, the insight that I have, and I wish that I'd had that insight as a mom that I have now as a nurse. And one of the things I'm proud to say is that for my unit in particular, I provide that insight to other nurses and physicians as to, and this is what the parents are going through. Let's not forget that they're people. So one of the things I'm just hoping to do today, and I want this to be as interactive as possible. As I'm talking, please ask questions, and I'm not going to wait till the end. We can kind of just go with this freestyle. All of you have done the NICU experience for the most part. I know some of you have done the PICU. The PICU is a little bit different in the dynamic that we do age 0 to 18, and generally if you're in the PICU, it's not that you were just born with diaphragmatic hernia, something else has happened, your child got severely sick, and there's another reason you're there. Communication, I feel, has always been the biggest issue between parents and the medical team. And it's not that everybody doesn't have the same goal. I think it's just a matter of everybody's not sharing the same goal. So one of the things that I've learned through my experience as a CDH mom as well as being a PICU nurse is that clear, precise communication is essential. Professionalism on both ends is essential. I've seen the worst on both ends. I've seen where the physician or nurse was not professional to the parent, and that's very unfair in light of especially the stress that the parent's going through. And I've seen where the parent was so stressed that they could not communicate, and their anger and frustration of their whole ordeal has been taken out on the medical staff. So one of the things I'm hoping to do today is just be able to guide anybody that needs guidance or is asking for it on how to make that all come together. How many of you have ever participated in rounds? So really, that's not very many. Were you asked to be in rounds, to be a part of rounds on a daily basis?
Take that back, I have.
Okay. Were you asked, was it a regular thing, or was it?
Not a regular thing. It was really by chance, to be honest with you. We just happened to be there and they didn't kick us out.
Okay.
so not regularly.
Was there anybody that wanted to be on rounds and wasn't allowed to be on rounds?
I would have liked to be on.
Okay.
In the
Okay.
hospital we were at, we were told we had to be outside during rounds because they couldn't, like, you know, over the chance of you hearing other babies' information.
Right, the whole HIPAA violation.
Right,
Absolutely.
because it was just baby and baby. But in the bigger hospital where we had our private room, if we happened to be in the room, they weren't going to kick us out, and they were more than willing to include us and talk to us about it.
Okay.
So.
Okay. The one thing I'm proud to say is we're becoming a Magnet Hospital Children's National Medical Center, and we have incorporated rounds probably for the last year, and I can't say it wasn't without resistance from medical staff because of the whole, we used to do rounds in a very different way, and it's actually called us on our professionalism to have the parents there, and I think that's a good thing. And I think that it's opened up the lines of communication. You know what the parents are expecting from you, and you know what, you can tell the parents what the plan is for the day. It's kind of like if the parents aren't around, how are you making a plan without the parent? This is their child. They're the ones that need to be part of that plan. And so I think now, at least where I work, having rounds and having the parents present has changed the dynamics of care for their children, and I think it's important. So I would strongly advocate you to continue to advocate for your child and for yourself to be a part of rounds. There is, you know, I would even challenge you to ask if there's a hospital policy stating that you can't be present for your child's rounds, and that you would be respectful of other children's, to not, you know, violate HIPAA, but that you would really strongly like to be part of rounds, because I just think that's a very important piece. And I think medical staff that is professional shouldn't have an issue with that. Some of the team members, I don't know, again, if you're not a part of rounds, then you don't even really know who the multidisciplinary team is. It's huge. It's the social worker, it's the chaplain, it's the pharmacist, it's the dietitian, it's the MD, you know, to the fellow, to the resident, to the nurse, to the tech. You know, that's the whole team. And as a team, they run together, and each of them puts in their piece towards the care for your child. And again, you guys are the only ones that truly know that whole dynamics of what your child needs. You know that team members constantly are like, well, no, I thought you were doing that, and I thought you, well, no, we forgot about this. And it's always the parents that come and say, you know what, this is my child's history, I know it to a T. You forgot that piece. That's important. Or this is what we talked about yesterday with the last attending, so this is the plan for tomorrow. We kind of need you guys there as the glue to help continue to help us keep us on our path too. So I think that's very important. You know, when you're changing physicians over from month to month and things like that, things get lost in communication. So again, you guys are the ones that know every piece of that as you're part of your child's care. Stress and frustration is huge in intensive cares, whether you're NICU, PICU, CICU, it doesn't matter. The stress level's high. Medical staff are stressed because of, you may not know, you have your child here, but there's 26 other patients, and 3 of them could be dying simultaneously. There's a certain stress that I think each medical professional holds and internalizes and tries not to show the rest of the families what is going on with them. Not to say that that's your issue, but something to think about, just that there is other dynamics in an ICU that are going on that, you know, that you may be aware of or may not be aware of. But one of the things that I think is important is stress release. And when I had my daughter in the NICU, I wouldn't leave. I wasn't leaving. No one's going to make me leave. You can't, oh my God, you could die any second. I didn't understand what stable meant until I became a PICU nurse. Stable can be an intubated child. They can be stable. You can go home for an hour. You can take a nap. You can leave the bedside. And for me, I was just gung-ho of if, oh my God, I couldn't live with myself if something happened to her, and I left. And, you know, now I watch some of these parents go through that, and I just watch, I have a primary patient in particular. He's 15 years old, and he had a silo done, and his mother was this energetic, exuberant person that came in, and she's now there 55 days, and I watched this woman just go down, 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 more tired, and she hasn't taken a break, and she hasn't taken a respite, and she feels like she needs to be there every second. And there's been many days he's been stable,